شيء تقنية الأسسمنت أوف ذا هارت تقييم الأستاذ الدكتور حكيم شاكر. الجزء شباب مثل ما احنا قلنا انه الاسسمنت اوف ذا هارت هو انتو ماخذيه بالكورس الاول، وحتى احنا نسوي اسسمنت كومبليت للهارت المفروض ويا الليفر سيستم نركز على الابدومينال والثوركس شباب. فانتم مطالبين بهذين الثلاثة سيستمات، الهارت، الاسسمنت اوف ذا هارت، الاسسمنت اوف ثوركس، والاسسمنت اوف ذا ابدومن. جبت لكم هسه افلام حتى اتذكركم، وعلقت لكم على كل فيلم اللي يختص. شباب هسه هذا الفيلم يختص بالابدومن، اسسمنت اوف ذا ابدومن. حتشوفون بيه الانسبكشن اوف ذا ابدومن، حتشوفون الاسكولتيشن اوف باول ساوند، حتشوفون بالاسكولتيشن اوف ذا abdominal vascular sound، حتشوفون البيركشن اوف ذا liver، حتشوفون ايضا البيركشن از ذا abdominal general، تشوفون البيركشن اوف ذا spleen، تشوفون البيركشن اوف ذا bladder.
Before assessing the abdomen, consider the patient's history. If he reported abdominal pain, plan to examine the painful area last. If he has a full bladder, have him void to encourage relaxation. During this part of the exam, observe the patient's face regularly for signs of pain or guarding. Start by inspecting the abdomen from the ribs to the symphysis pubis. Its contour should be symmetrical. To highlight any bulges, shine a light across the abdomen toward you. No bulges should be visible. Assess the umbilicus, which should be midline and inverted. Next, auscultate the abdomen. Always auscultate the abdomen before percussing and palpating it, because these actions can make bowel sounds more active than normal. Begin by placing the stethoscope's diaphragm lightly on the right lower quadrant. Because the ileocecal valve is in this quadrant, bowel sounds are usually audible here. Listen for at least 2 minutes. Assess bowel sounds in all 4 quadrants. Determine if the sounds are normal, hyperactive, hypoactive, or absent. Be sure to listen for 5 minutes before concluding that they're absent. Now auscultate for vascular sounds by switching to the bell of the stethoscope and listening over the aorta, renal arteries, iliac arteries, and femoral arteries. Listen for bruits, which may be heard during systole. Bruits are abnormal. Next, percuss in a systematic fashion. You should hear dullness over the solid organs and tympany over the air-filled organs. You may also hear dullness over a distended bladder, adipose tissue, fluid collection, or a mass. You may hear hyperresonance over a gas-distended organ. Now percuss each organ, beginning with the liver. To assess the liver, percuss from the right lung area down the midclavicular line until you hear dullness. Mark this point, which is the upper border of the liver. It's usually located at the 5th intercostal space. Then percuss up the midclavicular line from the umbilical level until you hear dullness. Mark this point too, which indicates the liver's lower border. It should be at the right costal margin. Measure the distance between the 2 marks to estimate the size of the liver, which should be 6 to 12 centimeters. Now assess the stomach by percussing over the left upper quadrant. Percussion here should produce tympany. Next, have the patient roll onto his right side. Assess his spleen by percussing from the 6th rib down the mid-axillary line. Expect to hear dullness between the 9th and 11th intercostal spaces. Now percuss at the lowest intercostal space in the anterior axillary line, where you should hear tympany. Then ask the patient to take a deep breath and percuss again. You should still hear tympany. If you suspect the patient has a urinary problem, percuss the bladder. Start at a point 5 centimeters above the symphysis pubis and continue to percuss downward. You should hear tympany over an empty bladder or dullness over a